Hi, this is Maureen O'Hara. I'm just continuing on with the Tuesday bundle, the forms that you're going to get. I just finished up the post-op day zero orders, which are the post-op orders. What also is in there is this brief op note. Um, and I just did that because we were tired of struggling with people's handwriting. The form's a little outdated, but I think you can make it fit your situation. It's also on the intranet if you want to print it. Take it with you, put it in your pocket. This is the post-op check form. I did that just to make it easier for you. Be sure to date and time and just check off the things that are pertinent. This is a little bit older form, so you may have to change this to post-op day 1. Also on the intranet. And then here's the daily note that I had in the admission package that we use for post-op day 1 to 5. Also on Wednesday morning, we're going to do this transition to community form. This is how appointments are made at Rancho. This is the system that they use. I fought this for a long time and I finally decided to join them. It was just easier. So for the Monday people, these are people with 2 feet. We want to make them an appointment for 2 wound checks and the suture removal. So they'll have an appointment for the first 3 Mondays after surgery. If there's a holiday in there, like this one was, then you just need to skip to the um, next Monday that's available. So that means that sometimes they go 3 weeks to 4 weeks for their suture removal. That's okay. And then you want to, so you put in the date that you want them to come, what it's for, and the date of surgery. The reason why you want to put in the date of surgery here and what kind of appointment it is because that is the comment that will be put on the appointment list so that when the patient comes back to clinic, then you know why the patient is there, even if the patient doesn't know why they're there, which is frequently the case. And then we want to transfer this information to the post-discharge care instructions. Be sure to sign, put your number, print your name. Okay, the ODA service has their own post-discharge care instructions, which are specific to our service and have been done so that it's just easy to check things off. So one thing you want to do is to be sure to check off who the attending physician is, write their name in here. That's why you need to know that for the list. And then check off that they have diabetes. And then if you can just put in here whether they have type 1 or type 2. Most patients, 95% of patients have type 2. So that helps us with the coding and the billing. Obviously, if the patient's not diabetic, we want to check that off. So what was the date of surgery? What surgery did they have? I like to add in other things here that change the way you treat the patient, like CABG, for example, is a good thing to know, or if the patient is on Coumadin for some reason, so that when the patient comes back, sometimes this is all you have. Check off that they're post-surgical. I used to write for pain medication, and I know you all don't have licenses, so just leave that blank. Somebody will prescribe pain medication for the patient. And then we want to have the weight-bearing status, what equipment they get. Everybody gets a splint except for AK patients. And then we have these special instructions. I think I'm going to stop here and I'll pick up with my next segment.